Hello, everybody. I'm Cami Edson. I'm with Boulder County Public Health. I'm the business liaison for the personal service sector. And so welcome back to those of you who are returning from previous weeks, and welcome to those of you who this might be your first session. I'm going to do a quick overview of some of the topics that we have talked about in previous webinars that are recorded and available on the Boulder's Chambers website. And I know we'll have time at the end for some Q&A. So for those of you who might be newer, if we don't quite get your detailed question covered in this session, we probably have a resource or an answer for you. Just chime in, or we can also connect after this session. So I'm going to go through what we're going to cover today, which is really just an overview, not as much details, like I said, of what we've been going over the last few weeks about safer at home, but I'll review a few key documents and points. We'll review the face covering orders that are currently in play for this business sector. Some key resources and additional resources that y'all might want to know about, as well as review some common questions that have come up over the last week that we have some answers for or trying to collect answers for, as well as in another Q&A session at the end for what's hot today on your minds. This is a slide that we've shown before, but just to reiterate, safer at home. And the face covering order that ended on May 9th, or safer at home went into play from safer at home or stay at home on May 9th. On May 12th, there was some additional guidance around what could happen at state parks, and that we're all anxiously awaiting for the new state order updates that are coming out on May 25th. A few of the sectors that we know are going to have updates are listed here, which is about spring skiing, restaurants, and summer camps. We don't know, just like you, the rest of you, what updates are going to be included from the state around the existing order that outlines guidelines for you all. I would say be safe to expect that a lot of it is staying the same. There will be probably some changes and some additions, but we will get it the same time the rest of you get it. So we're not sure what's coming down the pipeline. And that basically the safer at home process, I think, you know, we've mentioned this before, it's ever evolving, it's going to keep changing, but we're going to be in a safer at home version for a while. The state has made it very clear that they will not lift the safer at home order until these things are in place, which are listed under the new normal bullet here, which is kind of either vaccines, treatments, herd immunity. Those are the criteria that are being looked at collectively to move out of the safer at home category in Colorado. And most likely it's going to be months and months before that happens. So I think just be patient and just know the safer at home process is an ever evolving one, and that we're going to be kind of operating within it for a while. This is local data. We thought we'd try to start sharing some data for you, and that it's basically showing the average, 5-day average of new cases in Boulder County since the middle of March up to the most current data available. You could see that in early May, late April is when we sort of had our peak. And the reason we wanted to share this is that it looks like from the early data that the safer at home order and the mass orders are helping the case rates. You know, we're not necessarily spiking up yet, and I hope we don't. So we just wanted to, you know, say thank you to all of those who are following these guidelines carefully and closely and supporting that not only in your businesses, but also in your personal life, because it is making a difference. Just some friendly reminders about the order as well is that even though I know many people are bringing this up, that there seems to be kind of a disconnect or kind of parallel message going out as open and start, you know, living your life again, but then also stay home as much as possible. And I think, you know, we just want to reiterate that while things are open and available to you, it doesn't necessarily mean you have to go do them. If things are elective and you can wait, possibly. But we know businesses obviously want to start making money and support the local economy and their local staff and themselves. So there's a balance there that is not necessarily always in perfect harmony, and everyone, I think, recognizes that. And just to remind you that COVID-19 is still just as contagious as it was before. Just because things are reopening slowly and progressively does not mean that the virus is any less contagious. So please keep defaulting to sort of the safest practice possible. And that locally and at the statewide level, there are face covering orders in effect. And we're going to review the face covering orders in more detail in just a little bit here in my presentation. Going to start off, you'll start seeing in a lot of the emails we provided, and last week we started to try to clarify that Boulder County Public Health can't provide legal advice. The orders that we're operating under for stay at home when it comes to what businesses can do, those orders are coming directly from the state. And we aren't in a position as Boulder Public County Health staff to necessarily advise you on what is state requirements. We're trying to help provide resources and help answer common questions and make sure that you're interpreting what's in the order as correctly as possible. But we can't go through detailed, we're unable, we just don't have the capacity to go through every person's individualized situation. And that if you really have these detailed questions that you're really stumped on, or you're not sure if you're able to meet them, if you aren't able to get a response from us fast enough through the channels that we share with you to reach us, please reach out to a local attorney or your attorney who can help you get the support you need and interpreting kind of the who can give you some legal advice on these on this order. So here are the common questions that keep coming up in personal services is, where do I fall? Am I a limited healthcare professional? Am I personal services professional? I'm not listed as either operational or not operational, so what do I do? Very understandable. I'll start with the first part is the main difference between limited healthcare and personal services is that their requirements are very, very similar, except limited healthcare, their treatment has been prescribed by a medical professional. It's part of a treatment plan. So if you're doing massage therapy or chiropractic care or some other care where you are able to get closer than 6 feet to someone and provide that care following proper safety protocols, if it's part of a medical treatment, you want to follow the prescribed medical treatment, you want to follow the limited healthcare guidelines. You can do a lot of those same services without necessarily being part of a medically prescribed treatment plan. You would fall under personal services. And then for those of you who are really unlisted, you haven't been listed as a profession that can operate yet, but you haven't been listed as one that is not allowed to operate yet. We know there's many of you out there. You're sort of finding a landing spot or comfort zone or a very close fit to personal services, and that makes sense. I've talked to a number of you, I know photographers or other kinds of studios or places that don't fit explicitly. Our recommendation is, again, one, possibly connect with a lawyer to interpret it yourself. But if you're able to, and then in addition to that, if you're able to follow the personal services guidelines, the checklist fully and all the requirements, then you might be able to, or then you should be able to possibly operate as long as you can meet all of the required criteria that would allow you to be operable under the personal services guidelines. And I'll show you where to find those in a second. Another common question that came up, which we reviewed last week, but I just want to reiterate, is that gyms and pools are closed. Please advertise as such. There's a difference between the personal training that is allowed to go on right now and gyms being open. Gyms are closed. So on your websites or as you're talking to clients or as you're communicating to the public, please do not say your gym is open for personal Just say that personal services personal training is available by appointment only. And just to clarify, 4 people total can do personal training. That includes the trainer. You can mix it up and combine it however you want. That could be 1 trainer, 3 clients, 2 trainers, 2 clients, whatever combination of people you want to put together, that's fine, but it's no more than 4 people total for personal training sessions. And that here's a caveat for a number of you in this personal services arena, but it doesn't apply to everybody. But if you're going to use a closed gym space for personal training, sort of on land, as we know, pools are closed and personal training is not allowed in the water, but on land, personal services trainings have been told that they can use closed gym space. The things you need to keep in mind is that it is still 4 people total per session. If you have 4 walls and a door that you can have people come in and out of separately, you can hold separate training sessions. So you can have more than 1 training session going on at a time. But regardless of how big that gym space is, some of you have reached out, you have very large gym spaces. And while it might seem rational that you could have way more than 10 people in their total, if you are using any sort of shared space, which might be hallways or doorways or restrooms, you're at a max of 10 people. So keep that in mind. You might be able to have 2, maybe 3 sessions going on, and then one other person who's maybe doing safety checks or controlling the people coming in and out of the door. But you are not allowed to have more than 10 people if you have any sort of shared space situation going on. And the other requirement is that 50% capacity. And the idea is you need to go with whatever number is less. Your 50% capacity might be well beyond 10 people. It doesn't matter if you could hold 200 people in there. You're limited right now for 10 people, because keep in mind, gyms are closed. These are not allowable parameters for gyms. These are the parameters for personal services, not necessarily gym specific. So gyms, I know it's not what you want to hear, but until some more specific guidelines come out or requirements from the state, these are the parameters that you need to kind of operate under. Mask use, these are some updates we want to share with all of you, is for personal services. It is required that you follow the Safer at Home order, which says under no exceptions are you allowed to take off your mask. We know that there is some conflicting language within other state guiding documents within the DORA guidelines and some of these other FAQs that have gone out, where they are using the standard language that says you don't have to wear a mask if you have a medical exemption. That doesn't apply to the personal services field or to the limited healthcare field. So default is my recommendation, or what I'm saying is default to the Colorado Safer at Home order. Again, these are state orders, not Boulder County Public Health, that you always default to the stricter order, which says that you must have your mask on at all times. So no services can be provided, so staff can't take them off and clients or customers can't take them off. So keep that in mind. And another update is that the marketplace, we've been talking about where to find personal protective equipment, PPE, is now available. I'm going to open this to show you what it looks like. So the link that I just clicked on, this is going to take you to a site called, oh, can you see it?
Nope, you're going to need to unshare that screen and then share.
I forgot, just a second.
And while she's doing that, I'm Corinne Waldown with the Boulder Chamber. I'll be helping ask your questions, so put them in the Q&A feature. But we'll also be asking you some questions today at the end through the polling feature. So be prepared. There's only 4 questions, but they're great feedback for us.
Sorry, it's taking me a second to find the share screen button again. Well, maybe I won't do that right now.
The green button on the bottom of your screen.
Yeah, there's no green button. Ah, sorry.
Is it at the top?
No, I'll just go back to this. So here we go.
You're still gonna have to share.
There we go. There we go. Yeah. I don't know why that was so tricky for me. All right, so here's the marketplace, the Colorado marketplace that we've been talking about for weeks. So it's very, very good. It's finally here. But if you come over to this Get PPE tab up top, it's going to direct you to a page that says, here's where you can purchase and come in to the site and find some available sources online for masks or sanitizer or gloves. A lot of different things are available here. We know there's other resources available out there. We have some resource lists on Boulder County Public Health's website as well that has some additional resources for you, but this is a good one. Just real quick here, I'm gonna take you to a few other resources that I wanted to kind of spotlight. Was that Boulder County did provide curbside guidance, and I know for a number of personal services, you also operate retail in addition to providing the closer one-on-one services. So for those of you who want to continue, and we really highly recommend continuing doing curbside, even though you are able to do it out of your physical space as well and have people kind of come in and shop. It just might take up that valuable no more than 10 people in a space. If you wanted to still, and we still highly encourage you to consider doing curbside delivery for those retail products. We do have a checklist for how to do that. I also wanted to point out that on the state's website, which is where all the Safer at Home information can be found, a lot of the commonly asked questions are on their FAQ page. And are you still able to see this, I'm assuming? Okay, good. So there is, if you scroll down, I think I showed some of this last week, but there's business section, there's childcare section, education. I wanted to keep going down, labor and employment, local governments. Here's a section for masks and gloves, which is helpful. Places of worship, local and personal recreation. For some of the personal trainers, you're going to find some helpful information buried within this section as well. So just wanted to point that out, as well as, oops, let me get to one other resource here. Even though not all of you typically follow DORA, which is the Department of Regulatory Agencies, a lot of the salon type services or chiropractic care, massage care, a lot of you that fall into personal services do follow the DORA updates. But for those of you who don't, in lieu of any other state guidance being available for your specific sector, you can come to the DORA website and you can see what is being offered for some of these other personal services guidance, or excuse me, some clarifications of like their version of the FAQ. Oops, that's not what I wanted to share. Let me go back one. Salons, I'm sure most of you have seen this, or spas, you've seen this already. This is where we know, unfortunately, for some of the mask guidance, the language in here is saying you can, masks don't have to be worn if there's a medical exemption. This is where we think the DORA language, they kind of cut and pasted possibly the wrong language, we're not sure, but we've passed it up to the state that says it's not consistent with the Safer at Home language. That's why I just wanted to remind everybody, default to the Safer at Home language, which is the state order, which is the stricter order saying that you cannot remove masks for any reason when you're providing services. Okay. So let me go back to the presentation. So we just went through some of these slides. Oh, I didn't show you the symptom screening, but I just wanted to reiterate, I guess on our website, Boulder County Public Health, as well as on the state website, they have a great sort of how to conduct symptom screenings. I know it's been brought up in a couple of these other webinars for other sessions about possibly having a how to do symptom screenings or how to put on and off masks safely. So instead of just sending you to websites that make you have to walk through it yourself, maybe actually hosting one where for those visual learners, they actually can see it happening and talk through it. So I know that's something we're looking into as well. But both symptom screenings and putting on and off masks, I know we've heard are things that might be helpful for the business community. And then another common question that has come up over the last few weeks is, what do we do if we think there's an outbreak, or how do we know if there's an outbreak, or do I have an outbreak in my business? What do we do? And so to remind you that have been on before, or in case it's new information, an outbreak is defined as 2 or more confirmed or suspected cases within the last 14 days. And as a business, what you're asked to do is, there's a link here. It's also on our website, and I know Corinne will probably share it with everybody in the follow-up emails. But there is a form that kind of walks you through, and the directions are included, that you need to report it to the Colorado Department of Health, as well as please send it to our team, which our email is listed below here, and we will help determine what action is needed next. It's not always that you need to close. It's not all, there's not a one-size-fits-all response for when there's a suspected or confirmed outbreak. We'll get the process started with you, and we'll get you involved with the local epidemiologist who will get into the weeds with what's going on in your individualized situation and come up with the best plan of action for you. So just know all you need to do is start coming to this, come here, fill out the form, send it to us, and we'll get you through the process of what needs to happen next. Here is just a summary of all the different guidance and tools that we have collected to try to help you interpret the state's order. A lot of this has come from all of your great feedback from all the questions you've been sending, not only me, but all of the other sectors where we can tell these are what businesses are needing or finding an easier place to find them. So we've put them all in one place. The web page down at the bottom here is where you can find it. But the checklist, I wanted to just reiterate or reinforce or remind or just share for the first time that we have taken and created these checklists. They're not mandatory to use, but the requirements within them are mandatory to follow. So we took all the state's general guidelines for any business reopening plus the sector specific guidelines and put them in one handy dandy, we hope, checklist for you to follow. So personal services, yours is sort of listed here second at the bottom. We've shown it for the last few weeks. I bet a lot of you are familiar with it at this point, but just wanted to also reinforce that a lot of you might also need to follow the retail checklist. You might also need to follow the office space checklist. There might be another checklist you need to follow, but commonly it seems like folks within this personal services world would follow, I guess, what's listed here at the bottom 3, office, personal services, and retail, depending on what kind of services you're beginning to operate and offer to the public. Again, a lot of these are we've gone over them already, but this is our Boulder County, our resource page for you that we pulled together for everything business related, business resources related to COVID-19. This will take you to the state's website that has where the guidance, all the requirements are coming from, the state ordered information. All of our local chambers are wonderful and sharing a lot of the same information and making sure it's available to all of you. Your development centers, your industry associations, they will also have a lot of information on best practices for your industry. While we're not necessarily experts in everything that you do, we're trying to make sure you at least know where to go to look for that stuff. Local licensing agencies in your cities, they also might have some additional either best practices or some guidelines or recommendations for you to follow. And just sharing that we're doing these ongoing office hours every week, different sectors at different times. I'm excited that we're having our weekly Spanish sessions coming up available as well, but we will have kind of the same Q&A session and hopefully get more interactive with it every Tuesday at 4 o'clock for the foreseeable future. And then please, please feel welcome to join any of the other sectors that you feel like you might overlap with as well. And I know, Corinne, you're going to do some interactive Q&A, right?
I sure am. So we have quite a few questions that have come in, but in the process, what I'm going to do is ask the audience questions. While they're answering those, I'll ask you some questions to answer. So I'm going to launch the first question, which is, in the last 24 hours, what % of customers do you estimate wore a face covering while coming into your business? So have you answered that? As people are responding, I'm going to ask you, Cami. Someone wrote in, I work in a studio or suite, most likely a hairdresser.
Okay.
Can I do a husband and wife in my studio at the same time as long as everything gets wiped, sanitized when they switch chairs?
The suite situation, as long as it's 4 walls and there's a door and they can follow all of the requirements for the personal services kind of within that individualized suite, which I think is what it sounds like the situation is, that yeah, the husband and wife could come in at the same time.
Okay.
Because essentially that space is being considered 10 or less within that space.
Okay.
Just coordinate with the other suite owners that the coming and going is coordinated as well, that you don't ever have more than 10 people in those shared spaces when they're entering or exiting the building or using the restrooms. That would be the piece to consider, is work with those other suite owners to ensure safe entrance and exit into your individualized suite.
Okay, thank you, Cami. All right, does every business that is in personal services need to take temperatures of their clients using an infrared thermometer? So I think there's 2 parts to this question. Do they need to take temperatures of every client, and does it need to be an infrared thermometer?
First part of the question about does every client need to have their temperature taken, that is a yes, there is. So in your communications before or when you're making appointments, I would share that with your clients that is a requirement that has to happen. And then on the business side, you're required to keep a log of that. And in the symptoms checks information, in the information provided on the checklist for personal services, there's links and resources to logs you can use, how to do it, all of the how-to piece to do the symptom checks on clients is available within the checklist. It doesn't have to be, oh.
Hey everybody, this is Zach Swank with Boulder County Public Health. I have a clarification on Cammie's response. So symptom checks are required for all customers of services with close personal contact. So not all personal services have to require symptoms checks for customers.
So if they're coming in for retail, possibly, yeah, no, but if they're sitting down in your chair for a service, yes.
Sure, yeah, so like, you know, elsewhere in the order, they differentiate high personal contact and low personal contact as, with some examples, you know, high personal contact being beauty professionals, massage, etc. Low personal contact being movers or repair services, for example.
Yeah. All right, thank you. I'm gonna add 2 more questions to the temperature check piece. Why don't we take temperatures screenings outside?
You definitely can. I think when and where you do it at your business is up to you. You don't necessarily, the client or customer coming in doesn't necessarily have to enter your business. If there's a way for you to set that kind of process up that you're more comfortable with, by all means, do it that way.
So Zach, will you mention some of the caveats that have come up on the manufacturing call about the temperature outside, especially with infrared?
Oh, right.
Yeah, and we're moving into the warmer weather. So, you know, if someone comes, you know, they've biked over to your business, you know, maybe you're up on the hill, they've worked up quite a sweat, you know, that's going to throw off a temperature reading. So, you know, if they are otherwise state that they're otherwise in good health and they have no other symptoms, you still can't let them in if they have an elevated temperature. But you can say, you know, why don't you go, you know, hang out under a tree, come back in 5 minutes, we'll take your temperature again. So that's a best practice if, you know, folks are, if it's a hot day, you know, if it's happening on a cool day, not going to be the issue, but if it's a hot day, that's the best practice there.
And can we just share real quick that Melissa Ellis, I know she walked away, but she's actually our body art expert. So if there's people who have body art questions, she's available on this call as well. So for them not to necessarily hold back.
Yeah, I do have one from Melissa coming up, but I'm going to finish on the temperature reading.
Sure.
One of the people on the webinar said that they've had a lot of fever readings when they do the temperatures outside, especially when people are exiting their vehicles. So maybe that's why some aren't doing it outside. There's also a question about, in one of the instructions for screenings, it's mentioned to give the person screened or when their temperature is taken a colored coded bracelet. And I get this question a lot in email. Are these a requirement or example of how employees might be screened or customers might be screened? Is this a requirement or is it just a best practice?
I think that is more, I bet that's coming from the office, the general guidelines for office practice. Zach, am I correct on that one?
It's also in CDPHE's video of how to conduct a temperature screening, and it's a best practice.
Best practice, yeah, it sounds like.
Okay, so I'm going to launch. I have a couple more. I have quite a few more questions actually. I'm going to launch the next poll. The next poll, while we're listening to these answers, is how would you rate customer behavior at maintaining at least 6 feet physical distance from other customers and staff? So have that going on. But just to be clear on the temperature issue, this question is, we're using a log for the limited number of employees we have, but are you saying that we need to take the temperature of our clients as well?
Correct. And you can use the same log.
Okay, so you need to log your employees and your customers, and you're not allowed to let them in when they have a temperature above 100.4, correct?
Correct. 100.4 correct is the automatic, we need to reschedule, you know, go home, we can't provide services today.
And I would just reiterate that that is true for personal services with close personal contact. So again, you know, massage therapists, beauty professionals, etc.
Okay. So I've gotten some comments that on this question, you haven't really let people into your studios yet. You're still in the preparation phase, so you're not able to answer the polls, which is fine. You might also be able to talk about when you go into other facilities, but yeah, please only answer the questions if you're able to do so. All right, Melissa, I'm gonna put you on the spot.
Okay.
All right, what is the proper amount of time in between clients, tattoo and piercing related? We started with 1 hour in between, but would like to move to something that fits our time better, say 30 or 15 minutes. What's the proper amount of time?
Can you see me okay?
We can.
Just say my iPad's acting weird. I'm not exactly sure in terms of like what you guys require. What we would require is that it's the proper amount of time for your sanitizer to work. So for your cavicide to work, for your maticide to work. So sometimes that's 10 minutes. So for example, when there's been temp events, you know, and they're tattooing or, you know, a bunch of people, you have to wait the proper amount of time for the sanitizer to work, which I would just, you know, I would give it at least 10 to 15 minutes if you're really leaving it wet and letting it do its job according to the instructions on the bottle. But I don't know anything else in terms of like aerosol or for COVID. That would be something I think you guys could comment on in the same way for barbers and things like that.
Sure. Thanks, Melissa. I would add on to that you want to avoid encouraging people to congregate. So think about your waiting room area. So, you know, my chiropractor, for example, specifically, you know, she can clean her space in 5 minutes and, you know, do the disinfecting. But she's giving a longer time window so that, you know, it gives me time to, you know, saunter my way out of the building. And then the next person who, you know, always shows up early, we still don't cross paths. So that's the best practice of just making sure you've got enough time that, you know, you're not having people, you know, gathering outside, or, you know, if they are, you know, outside would be better than inside, of course, but, you know, you want to avoid the, you know, people crossing paths or, you know, worst case scenario, waiting in your lobby.
And I think the only other thing that's come up in general is more build in that time for your staff as well to be able to take breaks and not be crossing paths and coming and going with clients who are also coming and going. Because I think I'll do a very good job at scheduling clients, but there might need to be a little bit more mindful scheduling of the staff coming and going, since waiting rooms and locker rooms and a lot of those things are not able to be open. So they're going to need to go elsewhere to just kind of get a break themselves in between clients. So just keep all the people coming and going potentially timed within your overall time management. But it really is about, and just ensure you can get your spaces cleaned before the next person is really the general requirement.
Thank you. All right, I'm going to launch the next question. This one's a little bit longer. This is about what is most stressful, if anything, for your staff about the face covering and physical distancing requirements. Check all that apply. So while that's going on, I'm going to ask Cammie and Zach and Melissa, if the person who is receiving personal services is 12 or younger, do they also need to wear a mask while receiving personal services?
Great question. Yeah, and so I think, yeah, we need to be better at reiterating when it's a close personal services. So like getting a haircut or getting a massage where the provider and the client are closer together. The 12 and under applies in Boulder County for when you're out in the general public. But for personal services, the state requirement is that everyone has to have masks on for the services. So 12 and under still have to have a mask on for haircuts or massages or chiropractic care, just like everyone else.
Okay. So it's the strictest of the rules under which you fall. Yeah. So because
and we understand that oh, sorry, go ahead, Corinne.
Because personal services is the stricter of the rules, you're gonna abide by those.
And I think it's fair to say that, right, the general public does not know all the specific requirements that you as personal services have to follow. So I think that's really where that upfront communication when you're booking those appointments would come in handy, is to let them know, for you to operate, this is a requirement for you, even though they might not have to wear it in other situations, 12 and under, because that's a common question. For them to come into you and receive services, they still need to have their mask.
Okay.
Also worth noting that Louisville, Lafayette also have their own mask orders. So it's a confusing,
Yeah.
face covering orders, not mask orders, but
Yeah.
it's a confusing world out there. And yeah, if you have questions, continue to contact us. We're happy to suss it out
To
for
help
you.
navigate that. Yeah.
Okay, we have quite a few questions coming in, so I'm going to keep the poll open. Under the mask statement you stated follow the Colorado state guidelines, but the CDC recommends athletes not wear masks during workout. Do we still follow Colorado, or can we use the CDC's recommendation?
So yeah, and I was going to say, a lot of you have been sending in to us or to me great research articles and great recommendations from other places. And we're happy to collect them and then pass them on up to the state as much as we can. I would say the state is deciding these recommendations. They're their guidelines, they're their rules we're all following. So a good place to share those resources as well, if you haven't already, would be the state. Not necessarily directly to us, because it's just going to be a slower feedback to the state as that's what you need. So right now, we all have to follow Colorado's safer at home order,
which requires the mask even for the personal training if you're in close contact.
So all those recommendations and things you all are sending to me, it's great, and please keep doing it, but I'm just going to recommend give that directly to the state so they can factor it in their next order update potentially.
And I would just add, the CDC guidelines are guidelines. The state's order is a requirement.
There we go.
Okay, thank you. So we had a question about Energize Colorado. They're asking if this is just for business purposes, and I'll answer this question because it was created by a group out of the state of Colorado, including Brad Feld, and it's a marketplace for businesses. So the first question you ask is, are you a nonprofit or for-profit business? So they can judge whether to charge tax or not. And then it is a place that you can buy in bulk masks, surgical masks, N95s if you are a healthcare provider or limited healthcare. So it is a great resource, and we've been asking and pushing for it for weeks now. So it is live, and we're all kind of happy about that. Do you guys have anything to add? Do you want to add on that one? But I think it's pretty clear when you go in that it's meant for business. All right, as an LMT, are we supposed to be changing our masks in between clients or after cleaning, and how and where would be the safest?
Can you repeat that again? As a licensed massage therapist, what was it?
Are we supposed to be changing our masks in between clients or after cleaning for that client? How and where would be the safest?
Oh, great. And that's where, I don't know if Jesse's on here too, because he might get a lot more of those specific for the limited healthcare folks too.
He was on, but I think he just jumped off.
I don't know that I know that exactly. I think looking into the limited healthcare sector might be a good idea. We can follow up and maybe provide that afterwards, Corinne, but I would think if you keep your mask on while you're cleaning and then dispose of all the cleaning supplies in your mask at the same time and then don a new one, makes logical sense. But again, if massage therapists have protocols that are standard about what order they would do that in, then they would follow their kind of industry standards.
And they're not required to wear surgical masks for personal service massage therapy, so it could be a cloth one. Sorry, Zach.
Mm-hmm. I would add that that would certainly be a best practice, but everybody's having limited supply, right? And there's nothing in the order that requires that. I think if we had an unlimited resources of masks, that would certainly be safer. But you would need to weigh that against what supply of masks you have available.
Yeah.
Okay.
And I think we'll just remind you can give your clientele masks as long as they're unused disposable ones. Otherwise, the cloth masks are fine. So the workers who are wearing the cloth mask might not have multiple to change, like Zach was saying, multiple to change throughout the day. But you cannot give those out to anybody to use if they don't come in with their own. It'd have to be a clean disposable one.
And there's great guidance. Gloves? Okay, I'll address gloves too. Yeah, there's great tips out there in terms of how to properly take off your mask. You don't want to touch your mask from the front, pull it off, or you don't want to adjust it, because then you're contaminating your hands as well. So pull it off from the ears, the back straps, etc. Gloves. Was there a specific question, or just gloves in general?
Just gloves in you would change them between clients after cleaning. dispose of gloves. We've had a lot of questions about disposal of gloves.
Yeah.
I think, I know for a lot of the services, they were using gloves before this started too, in general, whether, for hair dyes or, other, whatever it might be, there's a lot of glove use anyway. You'd follow your kind of standard practice. I think in general, just the sanitation and the cleaning of spaces would increase, but you would still follow changing your gloves as often if you were before, if not more frequently. Definitely not less.
And changing gloves under personal services, strangely mentioned specifically between pets in all pet grooming facilities. But if you look under limited healthcare, they talk about it between changing gloves between customers, and washing your hands. So
and I think
I would follow that.
And in prior personal services, once we sort of clarified that, they mentioned pet, but we said people and pets change your gloves between clients.
And one person said they're using as a best practice, they put on their gloves, they see the client, they remove those gloves and they put new gloves on to clean, then they wash their hands and put on new gloves for the next client. So they're being very extra cautious with the gloves.
Yeah.
Which is great.
And I know in previous sessions it was brought up, can we use non-disposable gloves for the cleaning piece? And that was shared as yes. If you have different gloves that you wear to kind of reserve your disposable supply for when you're working with people, but you have different gloves that you can use for the cleaning process that are sturdier and can be washed and cleaned themselves, then you can use those gloves for the cleaning part and not have to use a disposable glove and waste that supply if it's limited.
We have about 9 more questions, but I'm going to launch the last poll question right now, which is what resources and support would be most helpful to your business at this time. So on some more questions, Melissa, one more question for you. Should tattoo and piercing artists be wearing arm sleeves and bibs?
I think that would be up to the tattoo artist. It's not a requirement in our Boulder County regulations.
Right.
It's a requirement in your regulations. That's like a contact, thing for bloodborne pathogens and kind of what's in the air while people are tattooing. So some people wear them anyway, just as really good PPE. But should you? I mean, that's kind of up to you, how strongly you feel you need to, be protecting your arms. You could always change your clothes. I mean, I know a lot of people like to change their clothes before they leave the shop and they go home just because of what they're around all day, but you're not required to, as far as I know.
Correct. Yeah, there's nothing specific to that in the personal services order or requirements.
All
Do you
right.
think so? Does anybody have any input on whether they think they should? Because that's the question is, do we think they should?
Right.
No, I don't have any.
Okay.
And that might be a great, if the field strongly feels that should be an additional requirement, I'd say, pass it on up to the state so they can consider it in future orders.
Okay.
All right, Cammie, are children allowed to accompany their parent if the children, are not receiving a treatment themselves? For example, if the mom comes in for a brow wax, can she bring her child?
That is a good question. So the order itself does not state that it can't happen, but as a best practice, we're recommending not if possible. It kind of depends on, because that child would now count as one of the 10 in the space. So that could affect everyone else who's operating within that same space. The child would have to be, try to have a safe 6 feet distance from everyone else, and that might be difficult to do. There's no waiting rooms or lobbies in any of these areas, so it's just going to be a difficult situation to manage. So just recommend it against it, but there's nothing that says it can't happen. But I would think that would need to be a clear discussion with who's ever booking the appointment for whatever type service it is, and the client coming in to know if that's a scenario that's going to be in play, because it would be, it could, be an unexpected challenge to try to deal with it in the moment if, if kids come along and no one was aware of that, because they still count as who you need to factor into the space and social distancing.
Okay. So, and we've heard a lot of businesses have taken out magazines, toys, because they're not allowed to convene and be in waiting rooms. So
Right.
That if the child's very young and needs,
Salons just have sit in the chair while you wait and process your hair. I mean, some like kind of that general waiting area that might have been retail. A lot have gotten rid of those.
All right, so we have some more clarifications on personal training and close proximity. Would ballet training fall under the close personal services, especially for 11 to 12-year-olds?
So that would all fall under the personal training or personal training services, which would be considered close. And so everyone has to have masks, and it's only 1 trainer to 3 students.
Okay. For indoor tennis training, if the instructor and client stay more than 6 feet away at all times, are they required to wear masks?
Sorry, say that again.
For indoor tennis training, if the instructor and client stay more than 6 feet away at all times, are they required to wear a mask?
And that's the thing. So the personal training services just says that you're required to wear masks at all times. So as of now, the language would point to yes. And that's where we hope there's additional clarity what personal training and gym use, in future iterations. But right now, it requires masks.
I've heard of also the tennis, you're not allowed to share equipment, so they've got individually marked balls. So only the people that are hitting that ball can touch that ball, and you're not allowed to play doubles and so forth. So.
And I think that's, it's come up with hockey. We've been talking about all sorts of different sports that people have been doing personal training. It's been, a lot of time with different scenarios this week. And it comes down to that is that masks are worn. Hockey, it's hard with the child, but yeah, you have to wear a mask, even though you have a mask on, and that no sharing pucks, bring your own puck. It's going to limit what kind of training and what kind of services you can do, that it may not be all that, it's definitely probably not going to be all that you would like it to be at this point.
So staying on that personal training, for personal services training, so the training under personal services, in addition to masks, are gloves also required?
That one has been tricky too. We sort of asked for clarity on that. I think it kind of depends on what kind of training is going on and how close and what's going on. I'm not sure if we get more details, but in some situation, it makes a lot of logical sense to have them, and others it doesn't. But right now, the personal services guideline or requirement says that yes, you must wear gloves, just like the previous answer with masks. You must wear masks.
Okay.
And this is a challenge with gyms not really being open. Personal training is very limited in what you can and probably cannot do, because you're having to fall under this larger set of guidelines, which doesn't necessarily directly apply to your situation. And so hopefully future orders will provide more clarity moving forward. But as of right now, it's a yes on both of those.
So I see some people raising their hands. Because we have so many people on this session, it's really hard to unraise hands and ask questions. So can you put them in the Q&A feature? I would really appreciate that. It's just not easy to do. Zach, put on your hat as to what the future looks like. What needs to happen in Boulder to move from 10 or less to a higher number for personal services businesses? Will this be decided by the state order? What does that look like?
Yeah, so right now, Boulder County, the only order that we have that's different from the state order is the face covering order. So we're effectively, fall back to the state order. Unless we have a shift in the amount of new cases we're seeing each day, I would expect that would remain true as Polis changes his order. So, what needs to happen is the state needs to change their order, and the conditions that they're going to be looking at is what are the rates of hospitalization, what are the infection rates. Cami, do we have that slide on the
yeah
chart?
We went over it before.
You went over it before. Okay.
Yeah, but
so the only thing that I would bring up on that is that today's data of the number of new cases today is really old information, right? Because of the incubation period of COVID, it can be up to 14 days on average. I think it's around 7. So someone who tests positive today may have been infected 13 days ago. And so, we're looking at, today's the 19th. That means that, someone who got infected on the 5th while we were still under stay at home here in Boulder County could just be showing up in today's data. So that's one of the challenges of projecting forward on when we'll be able to have larger gatherings, larger events, when we'll be able to further loosen restrictions. And the reason that some of these decisions are coming so slow is because we really need, really 3 weeks between making a change just to find out what was the impact of that change. Once we make the change, we don't find out the next day, we find out 3 weeks later. So that's some of the challenges. And so I don't have a crystal ball on, when we'll have larger events or when new services or sectors, business sectors will be opened up because of that delay in data and because, the decisions are happening at the state, not here at the local level at Boulder County.
And I think I've just tried to reiterate that throughout the presentation is if you have really strong feedback or information that you want someone to consider for future orders, definitely get it directly to the state, as those are the requirements we're following. It's not Boulder County at this point making those decisions.
And as you get more guidance, we'll be sharing with these groups to get feedback. Just like when we talked to restaurants earlier today and we're learning there may be additional guidance coming forth for restaurants. We're using these groups and these forums to get additional feedback on these orders and to present the information as quickly as possible. I think a lot of people don't realize you guys don't get the guidance much more in advance of when the public does as well. There's a question about, is there a point where we might receive guidance about performing arts, not just performances, but rehearsing for like performers, filming, videotape, and those types of things?
Very valid.
I would say same as my last answer. It depends on the direction of the disease and depends on, what comes out of the state in terms of their direction and guidance and orders.
Same with estheticians?
Yeah.
Everybody. So I suspect next Tuesday, we'll be full. We'll see when the new information comes out on Monday. Tuesday, we'll be all looking at the new information at the same time, trying to digest it, unless I'm off by a day or two. Sorry if I'm off, if it's not.
No, you're correct.
It's Monday, if I have my dates right. So we'll all be digesting it on Tuesday at the same time and trying to sort of unpack. And then we'll be updating our checklist that we've created as need be with any new requirements or any new fields that have been added or any new services or any kind of change to the requirements. We'll be working as quickly as possible to update all of our internal resources we've created and presenting those, next week in these weekly office meeting sessions and sharing what's changed as quickly as possible.
And to set expectations, the governor has forecasted that he will make a decision on restaurants, spring skiing, and summer camps. Those are the 3 things that are specifically called out.
Yeah.
I wouldn't be terribly surprised if there were other modifications to the order that came along with those decisions. But just to set expectations, those are the 3 that he's specifically identified. That,
right.
And he's just making a decision. It could still be, nope, the data doesn't support it, so we're sticking with where we're at. But I would say in general, you saw the data that can be presented, at least here in Boulder County. We're trending in the right direction.
So apparently your comment earlier about massage therapists and gloves sparked a few questions. Did you say the massage therapists are required to wear gloves?
The order says you're required to wear gloves unless it makes the service, unless you can't provide the service. So for massage therapists, their standard practice does not allow them, because I know that's come up before, that we can't wear gloves during massage therapy, then you don't necessarily have to. You just have to do thorough cleaning, hand washing in between clients. If gloves is one of those areas where your professional association and your normal guidance would prohibit you from wearing gloves.
And I would add that, throughout these calls, one of the purposes of these calls is to help clarify and answer questions around the order. But, if you think you hear us say something that conflicts with what you read in the order, then, we probably either misspoke or it was in regards to a different context. Yeah. So I would just encourage everybody to consult the order, consult the documents, our checklist, what's on the BCPH website. We're just helping to interpret the nuances and provide a little additional context where we can. But certainly we would not be saying anything on these calls that contradicts what's stated in the orders.
And I have to say, the other calls, so I'm on all 9 of them a week, and this seems to be one of the harder ones because there are so many industries that
different
fall
industries.
under it. Real estate's real estate. Office is office in a lot of cases, so it's a little bit harder. Just to give you guys a little bit of credit, that this is one of the harder ones to work through because there are so many industries. So I know you guys get the most questions on any of these calls, and you're trying. We have 3 more questions and we'll try to wrap this up. Has there been any update on pools? And I'm going to give you specific. We are from a tennis and swim club with memberships, no general public. Is it possible to request a variance so that we can be treated like an HOA, hotel, or apartment building?
Right.
So Boulder County looked at the pools. We thought we had an interpretation where, personal training could be done in a pool. And then we reached out to the state, and the answer is for pools, no. Pools cannot be open. And I want to actually just pull that up because it specifically calls out the types of pools that can't be open.
And
So our swimming pools allowed, indoor, outdoor, HOA, apartment pools, and gym pools. That's no to all of those. So I think that, the question kind of implied that, HOA and apartment pools could be open. And in the past, we thought that was true. But then the state has clarified that very clearly, no.
And they made some change on their guidance on that as the time went on. So in some cases, when we sent that out, it was a change that was made by the state in response to a lot of questions coming up on that.
And I think we've had 2 or 3 rounds, I know just for the sector alone, where we put something out and had to send something back out to the group because we've gotten an update that contradicts what we said. So, I mean, we're doing like we said, as we catch it and we know it, we're trying to get it back out to everybody.
Also, as Corinne said, they change, right? Back and forth. And it's just, I know how frustrating that is, but it is what it is. We try and be as nuanced to this as possible.
Yeah. Some of these questions are in the Attorney General's office at this point because of interpretation. But there's a question about there are at least 10 counties in Colorado that have applied for a variance. Typically, they revolve around places of worship, restaurant, and gyms. Does Boulder County have any plans to apply for a variance? If so, in what areas?
Not to my knowledge at this time.
Not to my knowledge either.
Zach, do you want to talk a little bit about how, because we're a metro area, the movement of traffic makes it a little harder to go against some of the other metro areas?
Yeah, exactly. Because of, so many people that live outside Boulder County, in a different county, but work here, and the close proximity of all the counties in the Denver metro area, they all take great care to be aligned. So even when, Boulder County does something different, like say our face covering order, there was a lot of work that went into trying to align that with what the other counties in the Denver metro area were going to do. So I think, Corinne asked me to bring that up, partly that, if we did request a variance, we would want to look at that in conjunction, with our nearby counties, because, some folks aren't really sure if they're in, Boulder or Broomfield County, right? Like where do those lines end? We would want to make sure that was done in conjunction with the other counties. So it's probably a little bit unlikely at this point that we would request a variance, and certainly not at this moment while we're a week away from an update from the governor.
I've just heard Lane talk about that on some of the other calls, so I thought I would offer that to personal services. One last question, and then we'll close this out. To clarify, we can't provide our clients with a non-disposable cloth mask, assuming they'll take it home with them and use it in future services. So they can people provide non-disposable masks to their clients as long as they're laundered or used further by that client?
Yeah, as long as they haven't been used by someone else, yeah.
Mm-hmm. Mm-hmm. Okay. Well, thank you. We got through quite a few questions this week. The audience was able to give us some feedback. I want to thank everybody for attending, for continually trying to get answers to your questions, for helping us to safely reopen so that those numbers don't pop up and we're not brought back to more restrictive positions. Continue to attend these calls, submit your questions, ask for feedback, and we'll get to them as best as we can and get you answers. But as I said, personal services seems to be one of the hardest because there are so many industries. Thank you for attending, and I hope to see you next week. And thank you to Boulder County Public Health, Zach, Cami, Melissa. We had a bunch of people on the call today because we knew that different industries, having someone from tattoo was very important to be able to answer some of those questions. So thank you guys.
And we'll just say that we acknowledge a lot of you aren't represented yet, and I hope you are sooner rather than later as you're patiently waiting.
And thank you for Corinne for your partnership.
Yeah, thanks, Corinne.
Thank you. We'll see you next week.
Bye.